Good morning, all. Infertility is a condition where the lady cannot get pregnant even after trying to conceive for 1 year. In the world, around 1 in 10 women are suffering from infertility. That means the incidence of infertility is around 10%. There are many factors that lead to infertility. Today we will see about different factors that causes infertility. I am Dr. Sreelakshmy Nair, fertility specialist and consultant gynecologist, Lifeline Hospital, Adoor. So, infertility, the causes can be 1/3 of the causes in infertility that leads to infertility are due to female factors. Another 1/3 is due to combined male and female factors, and around 20% is due to unexplained infertility. Before going to the causes of infertility, we have to know about the steps in reproductive cycle. So, it starts with ovulation. That means one of the ovaries release a mature ovum around the 14th day of cycle. This mature egg is caught by the fallopian tube of the same side, and the sperm should swim up through the cervix up to the uterus and reaches the fallopian tube. In the fallopian tube, fertilization, that means the sperm and the egg fuses together and becomes an embryo. Afterwards, this embryo comes and implants to the uterine cavity, that is here. So, this is the model of uterus where ovulation happens and the tube has to pick up the egg. It reaches here. During intercourse, the sperm swims up and reaches the tube. Here fertilization occurs and embryo develops. From here, it should come and implant in the uterine cavity. That is the normal side where the pregnancy occurs. So, the factors that leads to infertility can be due to, as I already told you, male factors, female factors, combined factors and unexplained factors. Now we will see about the female factors. The female factors, as already told, 1/3 of the infertility is due to female factors. So, of them, the most common is the ovulatory dysfunction. That means ovulation will not happen, or it will happen but delayed. So, the most common condition where ovulatory dysfunction seen is PCOD or polycystic ovarian disease. So, in PCOS, there is anovulation. 80% of the anovulation happens in PCOS. What happens here is, in PCOS there is hyperandrogenemia and also hyperinsulinemia. That means there is insulin resistance. So, this because of the hyperandrogenic environment, this follicular arrest happens and there will not be any ovulation. So, associated features you can see in PCOS are hirsutism, that means increased growth of hair, in facial hair. Also there is acne, and also there is black discoloration over the nape of neck, that is called acanthosis nigricans. Today in the world, because of this lifestyle changes, the PCOD is on a rise. Because of the sedentary lifestyle, use of junk food items, lack of exercise, stress, all leads to increased incidence of PCOS, which in turn leads to increased incidence of infertility. So, proper exercise, proper diet, all these are very important to maintain normal fertility. So, another condition like PCOS, ovulatory dysfunction can also result from primary ovarian failure. That means the ovary cannot function properly. That can be due to genetic causes or can be due to the destruction to the ovary as a result of surgery or as a result of chemotherapy, cancer treatment and all. Genetic reason is due to mostly seen in Turner syndrome, where the ovary cannot function properly. These are the some of the common causes of ovarian causes of infertility. So we have seen about the ovarian causes. Now we will move to the tubal factors in infertility. So as I already mentioned, the fertilization occurs in the tube. So the sperm has to reach the tube, and also during ovulation the ovum should reach the tube. So if anything that blocks the tube, that can lead to infertility. Subclinical infections, pelvic inflammatory disease, in all these conditions what happens is that the inside of the tube, that is there is lining which contains numerous cilia which aids the movement of ovum and sperm, that got damaged, and also blockade of this tube can happen. So the sperm cannot reach the tube, and so infertility causes. These tubal factors accounts for around 15 to 20% of female infertility. Also results of previous surgeries, pelvic surgeries like appendectomy and all, there are a lot of adhesions which can also damage the tube. So these are the tubal factors. Now we will see about the uterine factors. In uterine factors, the implantation occurs in the uterus. So anything which prevents the implantation means it is the attachment of the embryo to the uterine cavity. So anything that prevents or anything that disrupts this leads to infertility, like any growth in the uterus like fibroid, polyp, or any structural defect in the uterus. All these can lead to infertility. Also in conditions like endometriosis and adenomyosis, this microenvironment of the endometrium got disrupted and implantation will not occur. Coming to the endometriosis. Endometriosis accounts for 10 to 20% of infertility. In endometriosis, it is a condition where these endometrial cells, which is the normal cells seen inside the lining of the uterus, these cells grows outside the uterus. That can happen during menstruation, where the menstrual blood reflects and falls into the peritoneal cavity. Here the endometrial cells will grow, and that leads to endometriosis. So in endometriosis, the normal pelvic anatomy got disrupted. There is scarring, there is tubal damage, ovarian adhesions, ovarian endometrioma, all these can happen. Also inside the uterus, as a result there is inflammatory changes which will disrupt the attachment of embryo to the uterus. Also ovulatory dysfunction can happen, delayed ovulation can happen, or luteinized unruptured follicle syndrome, where the ovum is not released from the follicle. All this can be seen in endometriosis. As I already mentioned, the tubal anatomy also got disrupted, so chances of fluid in the tube, that is hydrosalpinx, hematosalpinx, all can be seen in endometriosis. So now we have seen about the ovarian causes, tubal factors, as well as the uterine factors in female infertility. There is also cervical factor, where the cervical mucus contains anti-sperm antibodies which can prevent the penetration of sperms. This and also the normal anatomy of the cervix can be altered in congenital anomalies, as well as trauma to the cervix, cervical stenosis. In all these conditions, this infertility happens. Then these are the female factors. So we have dealt with the female factors. These female factors, nowadays more advanced investigations are available which help us to find early diagnosis of all these conditions. So we will move on to the male factors now. As I already mentioned, the male factors account to, along with the female, combined male and female factors accounts to 1/3 of the infertility. According to the WHO criteria, which says that for a normal fertile male, the count should be around 10 million, and the progressive mortality should be around 30%, and the normal morphology should be around 4%. Any reduction in all these parameters can lead to male infertility, like infections like measles in childhood, varicocele, where the vessels around the testes are got bulged, that means their blood flow got stasis, and as a result increased temperature, which will damage the testicular epithelium, so the sperm production decreases. And also obesity, sedentary lifestyle, all these leads to lower testosterone level, in turn leads to low sperm count. Also associated sexual dysfunction happens. These factors lead to male causes of infertility. Also in some genetic causes like Klinefelter's, where there is chromosomal dearrangements, in that cases this testicular failure happens. So these are some of the male causes of infertility. So now we have seen about the female factors as well as the male factors that lead to infertility. There are certain causes, means we don't know the exact cause. When we are examining the female as well as the male, everything will be normal, but still they are suffering from infertility. This condition is called unexplained infertility. This unexplained infertility accounts for around 10 to 20% of infertility. The causes can be due to minute structural defects in the ovum or sperm, like the hardening of the zona pellucida, that means the outer covering of the egg, or the less penetrating capacity of the sperm. All these functional defects can cause unexplained infertility. So these are the major causes of infertility. As I already told, most of these causes are attributed to the lifestyle, because in today's world everyone is doing less exercise because they are sedentary lifestyle because of the profession and all, and also these habits like smoking, alcohol, chronic drug use, all these accounts for increased incidence of infertility. So we have to go for lifestyle modification, proper healthy diet, healthy exercise. All these help us to prevent this rise in infertility. And also when you find it difficult, especially in younger age, you can wait for 1 year. If you are not able to conceive after 1 year of trying, then definitely you have to go meet your gynecologist. And in the case of advanced age, like more than 35 years, what happens is that more than 35, as the age advances, the quality of the egg as well as the quality of the sperm decreases, chances of pregnancy also decreases. So in more than 35 years of age, better you consult a doctor after trying for 6 months. And also in more than 40 years and all, immediate consultation is needed because they may need assistance. So correct diagnosis and correct treatment will ensure a baby for all. Thank you.